The first slide is on what is it? Who's a good referral? Yeah. Oh, who's a good candidate? Yeah. So I think that this is always a good, important question to cover. So we get many different kinds of people looking for support. And generally people who come to us have, like, they've already done their homework. They know about neurofeedback. And it is a, very much an outside the box kind of treatment. So we really want to make sure that when people are coming to us, like they have an understanding of what they're getting into and the kind of commitment that is required. So like most treatments, it's not one, not everyone's a good candidate for it, but there are certain people who it really does make sense for them to work with this approach. So it, like Angela is saying, it is appropriate for many different conditions. In our clinic, we see that many people are looking for a somatic approach to mental health. And I think we're seeing this more and more, like people are really seeing, like, the limitations of top-down approaches, like talk therapy or CBT. And, they might have been doing many years of therapy, and they have like an intellectual understanding or good insight, but their nervous system, like from in a somatic level, they just feel this quite stuck or the same, or feeling, those symptoms of like hypervigilance, hyperarousal, which is very common with many of the people that we work with who have a significant history of trauma from an early age. So that's this next point here. We do see a significant number of our clients who do have these chronic symptoms of hyperarousal, but also that can be translated in chronic health conditions, and also people have anxiety related to these somatic symptoms. So some of them can be like chronic health conditions, like, IBS, like the stress ones that are related to stress, but we may also see people with like, just thinking like Lyme disease, for example, or long COVID. Also, like migraines are another one that we see quite a lot of. There could be other health conditions where people, their bodies are a source of threat, so they don't, because of their illness, and so they're on this sort of constant hypervigilance about what's going on internally in their body. Also people who have strong side effects to medications. So they might have been, trying a lot of different kinds of medications for mental or physical health conditions. And so I would say a lot of the clients that we see are very, very sensitive. They're very, very sensitive nervous system, so they feel a lot. And so that having a sensitivity to medication, they don't quite get it right. So they respond really, really, really well to neurofeedback. We get a lot of people who have done a lot of therapy, different kinds of therapy, and still, like I said, still feel that sensitivity in their body. Other people may come to it like they're just at the beginning of a healing journey, from a emotional perspective, but it's too hard to get to the words to actually talk about it. They need to bring their nervous system down. So like Angela was saying, like it's really, really hard to talk to a hijacked nervous system. So starting with neurofeedback can be a really great entry point. And I'll say, for those of you who are familiar with a treatment called EMDR, eye movement desensitization reprocessing. So a lot of people are seeking that out because it's also a very popular treatment for trauma. And people might come to EMDR and say, sorry, I'll get to that question just a minute, around insurance. Thank you, Teresa. People, what was I just saying? They, they're interested in EMDR because they just want to get through this trauma, but they aren't even like, they really, really need to do that stabilization. Really, really important. So sometimes like people come and say to us, we want to do this sort of more intensive intervention. And we assess and we realize, oh no, they really need to get to this better balanced place. And so I've seen that quite a lot. And these are often very good candidates for neurofeedback, but then when they do get to doing the deeper processing, which EMDR does, we can get to it much more quickly and more efficiently. And then the other kinds of people that come to neurofeedback are those who might have tried different kinds of self-regulating strategies like mindfulness, meditation. So I used to do a lot of work teaching these 8-week mindfulness groups, and for trauma, I used to do this at St. Michael's Hospital. And so we had a lot of people coming in really wanting to feel better, but then when they started working with these tools like mindfulness, they're just more aware of how threatening it is to be in their body and how hard it is. And so they would give it up. Whereas neurofeedback is just an easier way to get into that place of self-regulation. So, we are a mental health clinic, so primarily we work with anxiety and depression, and we find that it is a really great adjunct to psychotherapy and other mind-body approaches. So yeah, Teresa, you're asking a question about, I think we're going to get to that around the cost and the benefits. So in terms of just making referrals, we a lot of people have done research, like oftentimes it's like people who have read Bessel van der Kolk's book, The Body Keeps a Score. So that's, or they knew about Stephen Porges's work, so they're fairly well informed about the theoretical approaches, or they've read about it. But in terms of like our clinic, it's basically self-referral. And if people are making referral, as a professional, we ask that, people just share our information with the client, our website. And we do ask that people read, like there's a lot of information. There's a lot of information to process. So we do ask that people take a little bit of time to read about it and make sure like it really resonates with them. So the referrals come to us directly, people fill out a form, and then the first point of contact would be our office manager, Liz. And so she'll just assess, where the referrals come from, what people are looking for, what their background is, or what their understanding is. And so we ask them to get that basic information from the website, and then we go over just the costs and sort of the expectations, so we know that people are aware of the commitment. And then our manager will connect the person who's referred for an initial 50-minute consultation with the right therapist who seems like the best fit. And so then we make that connection. In terms of a commitment, so there's always a question around how much it costs and how it's covered. So the thing about neurofeedback is for this to actually be effective, it is a training and it does take time. So people have to understand that it's not sort of like going in for a massage and feeling better. It's actually, we're working with that nervous system. So we have to start with a very thorough assessment and, set up to do the training. And then we go through 20 sessions. And so our costs are, so we're mostly social workers. We have one psychotherapist. So we're billing under our professional license. And so the assessment, it's generally 1.5 hours, $225. And that includes a consultation. We do a standardized quick test, which is sort of a baseline measure of, it's like what do you call it? Like a attention test. And then we also set up a symptom tracker, which is called the results tracking system, which gives us a measure from session to session of how people are noticing changes in the symptoms that they would like to see to target. And then each subsequent session is 1 hour and our rate is $150 at full rate. And then the recommended course of treatment is 20 sessions. And if we do a quick test, the first and last, and then we're collecting data from session to session on the symptoms, which we can track and we can share with people. And it's also part of collecting data for the Neurofeedback Advocacy Project, which I'll talk about. And then we do a final reassessment at the end. Can we go back? Was there anything else I missed? Sorry. Yeah. Okay. Yeah. So then we do final reassessment at the end, which includes the neurofeedback session, the consultation, and then that quick test again. And so the full cost for the full course of treatment is $3,225. And many people will get, I guess that's the next slide, is that around coverage? So many people do come to us and they have it covered by their benefits. And so, I mean, there's a whole range of, benefits that are available to people. Some quite generous, some not. So we do, if people have coverage for RSWs or RPs, then they will pay us and they get compensated. We don't do direct billing. And we are also sign up for other sources of funding. So NAHB for First Nations clients, and also Medavie Blue Cross for veterans. We're not signed up for the for MVA clients. And then so we're also committed to providing some low fee options for people who don't have full funds, and we're creating new ways to make that possible, which I'll talk about. And this is also part of our commitment to working with the Neurofeedback Advocacy Project. One of the challenges about neurofeedback is that, even though it is, it's intensive and it can be a high price tag for people, but at the same time, when we see the changes in a short period of time compared to the years of therapy, it can, that people can be, paying a lot of money over years. It can be, even though it's a big commitment, there can be sort of long-term savings, but at the same time, we want to make it much more accessible and available to people. And that's what the Neurofeedback Advocacy Project has been all about. So we're working out sort of the details as we go along with the low fee options. So how we're making that possible is, like, we have clinicians who are trained, who have are registered social workers or registered psychotherapists. So we can work alongside a neurofeedback technician. So they're not making clinical decisions, but they can run the session after the therapist does the assessment and sort of sets it up. So that just allows us to see more people and do it at a lower cost. We do ask that people are able to self-identify as economically vulnerable or facing financial barriers to accessing mental health supports. And also if they have $1,500 or less in benefits to spend on neurofeedback. And also we just people have to understand, like, their technician's role is very much they don't have a clinical role, but they will work alongside. You always have the therapist that's available at the same time, but maybe not in the room. And so our technician, so our sliding scale can be anywhere from 75 to 125 per session. Standard technician is 125. Okay, so I want to talk a little bit about the Neurofeedback Advocacy Project and how we got involved. And this may also be of interest to others who might be interested in training for neurofeedback themselves. So a little bit of background. So I started off my training with an organization called the EEG Institute, and that's where the Othmers who created the system, they really are the pioneers in this field. And so I think it was 2016, I went down. So at the time, the only way to do the training was to go down to California, and to do this training, you have to go a couple of times a year to start. And we didn't have these online options. So So it wasn't very accessible. You have to make a commitment to go down there, then you have to get the equipment, and which is quite pricey. And then you do, after the training, you do online supervision on a regular basis to become certified. So that's where we started. Like, we started with the training at the EEG Institute. And then when I started this clinic, it was me doing it on my own. I realized, like, this is really hard for someone to do on their own. So, but it's also hard to get other people to go down to California and train, and it's very costly. So, so a couple of years ago, we got connected with the Neurofeedback Advocacy Project. And so that allowed us, it's an organization that was started by a man named Matt Fleischman, and also in partnership with Henry Kaiser, and they're both psychologists who've been doing neurofeedback for a long time, like maybe 30 years or so, very committed to it, and sort of at the later stage in their career, and really wanted to leave a legacy of making this more accessible, because it is a high price tag to get into. So they created this organization, which is a nonprofit that's committed to providing training in settings where neurofeedback is not necessarily accessible. Most people who trained in it traditionally have been in private practice and in solo practitioners. And so he really made a commitment, well, Matt's sort of the head of this, to bring it into agency settings, and like bring it to people who were working like in schools with high risk populations, addictions, trauma. And so, I think, as social workers are very, aligned with what his mission was all about. And so I reached out to him, and he was, very open to us joining, because we wanted to continue to grow the reach of neurofeedback. And also we've been working alongside so from the University of Toronto to sort of push forward some research as well, on a clinical level, more where we're very interested in sort of the accessibility piece. So I would say what the Neurofeedback Advocacy Project offers is very, very low cost training. So it's like $500 for a full training, which is like it's 40-hour training. And that's in comparison to the over $5,000, and this is US, that one would, that the cost of it to go down to California. And that doesn't even include like all the extra stuff like travel and equipment. So it's a really, really wonderful opportunity. And we have been able to train, I think it's about 6 people so far. And so the training it's 40 hours of training over 2 weeks. They spread it out over 2 weeks. It's 4 to 8 hours a day. So you're doing it online, and it's specific time, but it's in a time that's manageable for our time zone. One needs to get equipment across the border. That's one of the challenges. So you have to get the equipment. They will provide the equipment for free for the training, which is kind of amazing. And then also you can rent the equipment on a monthly basis at a very low cost. It does need to be done in pairs. So to train, because when you're doing the training, you're actually doing the training on yourself, and you have to like figure out how to where to place it on the head. So you need another body, another head to do it with. And the people who are running the training, one of the leading person, she actually jumped ship from the EEG Institute, was one of their head trainers, like the head trainer. And so she's really committed to the mission of the Neurofeedback Advocacy Project. So she's the head trainer. So it's really excellent, high quality training. And the requirement for participation is that you have to be identifying, serving vulnerable, underserved populations. And now, I think if you're in a group setting, like an agency, like there does need to be somebody who can be identified as the overall supervisor. But I do know that some people have been working independently as well. And I guess I'm not sure how they would do the supervision piece. But once people have done the training, then you can become a member. And that's actually where the learning begins, because that's where you start to learn how to actually apply it. So the membership it's very reasonable. It's like so it's $100 per participant per month. And so in an agency setting, that maxes out at 400. So you can have as many participants as there are in the agency. And so what the membership includes is you have bi-weekly consultations. So this is where the learning happens. There's a lot of conversations, and it's a different way of thinking. Like when we do neurofeedback, it's like there's a neurofeedback way of thinking. So it's really important to be having these conversations and to be problem solving. And that's why it's been really great for us as a team, because we have got a nice group that we're always constantly having these consultations. But in addition, we've got the bi-weekly consultations with the Neurofeedback Advocacy Project with really, really experienced clinicians. We also get to participate in advanced trainings that at no extra cost. So they're always coming up. So there's, in addition to the infra low frequency training, there's something called synchrony. And then another, which is more sort of, we'd say it's like sort of a deeper state of mindfulness that people access through this training. And alpha theta is in more intense it's more going into sort of deeper states of consciousness, which is also very helpful for processing trauma. And also there's workshops on advanced optimizing. And then also as I mentioned, there's a discounted equipment rental. Okay. So I did explain a little bit about our background. So we started with the Asian Institute, and we were able to expand our reach by participating in the Neurofeedback Advocacy Project. And so now we have 4 therapists and 2 technicians. So it's, more possible to expand our reach with having a bigger team. And so our goal in participating in this is not only to expand the reach of our services, but also for people to understand this different kind of treatment and therapy, and with the possibility that I think as more people know about it, more people may take interest and want to offer it themselves and be, part of the neurofeedback community. And so one of the things that has sort of grown in the States is this idea of a consortium where even if it's not like different, growing within the clinic, there is a community of clinics or therapists who work in this way. So it's really just about raising awareness and possibility that other people might actually join in that consortium. So one of the ways that we can provide this information session. So if people would like to, are they interested, and we'd happy to talk about our experience. And also, in the future, like we would have 2 spots available. We can train, we have extra set of equipment, so we don't have to get it across the border. We can train 2 people at a time. So there is one, just to let people know, there is a training. Actually, the deadline is Friday to sign up, but they have them every few months. So there is a next training in October that's coming up, and the deadline's coming up. So just to keep that in mind. I think that's it. Is there anything else? Yes. Okay. I've got through it all. Sorry. Only 5 minutes per question, but we can go a little bit longer. Yeah. So, yeah.
Yeah. Opening the floor to any questions. And also, I wanted to add about the supervisor thing. I know that there are some agencies in the States like that are working in tribal communities, and their capacity is much more limited. So they like offer space. They'll commute to the other clinic that first trained and kind of access the supervisor there and then kind of go back. So there's flexibility.
Yeah, Colleen.
I think I have a couple of questions because I'm still understanding, but thank you for presenting this.